So I'm going to do dry needling on Kira's thumb today. So given what she experienced, so when I palpate her thumb, I'm gonna compare her both thumbs, and as you guys see, her left thumb feels more prominent, and I can feel like a little extra bone mass. So it should be bone spur, which is one of features of arthritis. So left side. So she complained of pain here. So where do you feel
pain? Here and in this joint, this whole joint.
Okay. So this is her thumb flexor muscle. So I'm going to dry needling her thumb flexor muscle, but not from here, but this way, because usually humans have more sensory receptors in the palm area, so it's going to feel more painful. So when dry needle through here, she's going to feel less discomfort. And so this is the flexor, thumb flexor. This is a thumb abductor. So when it comes to thumb, we have 4 movements: abduction, adduction, extension, flexion. And the culprit for thumb arthritis is abductor and flexor muscle. So today I'm going to dry needle her abductor and then flexor muscle. So for the abductor, I'm going to approach from here, and for her flexor, I'm going to approach from this angle. And this is her adductor muscle, which brings her thumb this way. So I'm going to include this muscle too. So when it comes to dry needling, sterilization or sanitation is very important to prevent any infection. So therapists usually supposed to follow clean needling procedures. And I need to sanitize my hands too. And then when I pull the needle, I need to make sure I'm not touching any contaminated area. So it's called local twitch response. In easier word, it's going to feel like a muscle jumping.
Okay.
So when you look at muscle is composed of several muscle fibers. And some of the muscle fibers is responsible for the muscle tightness.
Okay.
So when the needle hit right tight muscle fiber, it's going to cause muscle fiber to twitch or jump.
Okay.
So they say the more local twitches you experience, the more relief you are going to have later. See? Okay. So sometimes needles might hit your blood vessels, causing bleeding. Then it needs to be pressed for like a minute. Then it's going to stop bleeding, and it's going to prevent like a future bruise.
Okay.
But it's not going to cause anything other than just a cosmetic issue, unless patient has like a diabetes, some kind of that kind of medical condition.
Okay.
So we need to make sure their diabetes is controlled medically by taking medication. So even those with diabetes, they're good candidate as long as their diabetes is controlled by their medical doctors with medication. Then I need to, okay. So make sure I need to locate her blood vessels. Okay. So now I'm gonna hit her at 8 of the muscle. See?
Yeah. Did make it twitch.
And then flexor muscle. Twice, right? Okay, stay there.
Ooh.
Now people, sometimes I'm asked by people and they ask me why we develop bone spur. So bone is encased by membrane, it's called periosteum. So all soft tissue, they don't attach to the bone directly, they attach to the bone membrane, periosteum. So your bone is encased by membrane, right? And any tissue, when you continue to use them, the length of muscle decrease and tension increase. So it's gonna pull your membrane out of your bone.
Creating more space
You're
between
right.
the bone.
Between the bone and periosteum. Then your bone start to fill the area with calcium. This is the
Gotcha.
extra bone mass, bone spur. So how dry needling help for arthritis is, or sometimes potentially prevent the aggravation of bone spur is by relieving tension. So soft tissue is not going to pull your bone periosteum. Then it can prevent the bone spur from getting worse.
Right. Because if there's more space, the bone grows, it adds more
Right,
calcium,
right,
make
right,
more bone.
Right.
And I can see the difference.
Right.
Me too.
Yeah. So, yeah, that's it for dry needling.
Anyone who's afraid of needles, it doesn't hurt. Like, it's not like getting blood or anything like that. Like, I didn't feel it.
All right. So.
Thank you so much, Dr. Jang. Do we have to do this again? Or is it one and done?
So I usually recommend people get dry needle 2 or 3 times.
Okay.
Yeah. So 2 or 3 times is usually recommended dose.
Okay.
The frequency, quantity
Okay.
of dry needling.
Okay.